Welcome back to the 180 System 21 question series. Today we're going to be talking about screens. There's a lot of talk out there on whether screens are useful, what they can and can't be used for, if they should be used at all, and we're actually on both sides of the fence on this one. So we do use a functional movement pattern screen here with the 180 System, but it's very different than probably what you've seen in the past. So what we want to do today is talk about what our screen is, what it's not, give you a quick look at what it looks like, and explain why we need to use this tool if we're going to be a function-based practitioner or physical therapy clinic rather than just a symptom modification practitioner. So let's take a look at what our screen does not do and what we don't use screens for. So we don't use a screen to establish a diagnosis. That's not the reason why we're using a screen. They don't dictate our treatment. The screen is just the first tool in our evaluation process that gives us a gross snapshot of what the patient can and cannot do. They don't ever find the root cause, so that's why they can't tell us what to treat and what not to treat. They don't tell us what to do, so we don't run somebody through a screen, see that they can't squat and say, oh, well, here's the corrective exercise or the 5 stretches that you need to do. That's not what it's for. We need to screen before and after every visit. This is what shows us functional gains, because remember, we're functional practitioners that want to get our patients back to normal function. We're not just trying to cover up symptoms. They shouldn't take forever, and they shouldn't need some kind of a flow chart or a checklist. We should be able to run through our screen in about a minute, find out what we need to know, and then move on to the next thing. Let's look at what our screen does do. It establishes our baseline as a functional tool. It also picks up the missing pieces that the patient might not have explained to us either in their history or in their subjective. They might have other surgeries or problems that they forgot about, that when we do the screen, it brings those problems out. It gets the patient to buy in because they understand if they're coming in to see us with left-sided low back pain, and that pain is reproduced with a right single leg stance squat, they understand that their low back isn't the root cause of their problem. It shows functional gains pre-screen to post-screen. It's a quick total body assessment so we can look at everything grossly. It leads to further evaluation because now we set the table for what we're going to look at next, and it helps lead to their home exercise program design because it's based on function and what they can do after the visit and what they can't do after the visit, so we can send them home with things that are appropriate so when they come back we're not redoing things.